should head in or out of 8 Indian variant hotspots. On Friday, the government website said people there should restrict socialising and travel. Yesterday, the directors of public health in Burnley, Bedford, Blackburn with Darwen, Bolton, Kirklees, Leicester, Hounslow and North Tyneside issued a joint statement saying the earlier advice should be disregarded. There is no restriction on travel in and out of the areas. There was then new guidance from central government saying simply that people should, quote, minimise travel to those areas. In a moment, I'll speak to Dr. Mike Tildesley. Before that, what do local authorities make of the current messaging? Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School. He's also been advising local authorities on their public health plans during the coronavirus pandemic. Dr. Pankhania, thank you for joining us.
Hello, good morning.
So good morning, what are you being told by the local public health officials that you're talking to in terms of their concern about whether the public is still heeding advice?
Well, it has become difficult because the public appreciate and want and almost demand that there is clear lines of communication consistently and clear evidence of what you're going to do when X, Y, and Z happens. And therefore, when people like us in local authorities or in authority start changing the game plan or do things without really explaining our actions, they stop eventually listening to us. And I have found that when advising local authorities, if we are consistently inconsistent, then our messages don't get through and they stop listening to us.
So you're saying that there is now an actual almost measurable decline in trust as a result of some of the mixed messaging.
We do find that indeed. And when we are encouraging people to be, for example, tested and then if found positive, isolated, we find considerable resistance at times. And all of that is they say to us, you really don't know what you're doing, do you? So I want to carry on with my life as normal.
And does the current advice strike you as clear? What does minimise travel even mean?
It's very difficult. And then explaining that at the ground level is well nigh difficult and impossible. And at the same time, we want to keep infections down. We want to control it and contain it. It becomes difficult, not only with minimized travel in and out, but there are other things such as to wear masks or not to wear masks in schools, etc.
Dr. Pankhania, thank you very much indeed for joining us this morning. The Indian variant is being detected in 151 local authorities in the week ending May the 15th. Let's keep perspective. Numbers are still